Alright, so I'm not going to go over the protocol because I already did a video on that. I'm just going to go and pretty much show what I do to find the appendix. So I'm going in blind. Let's see if I can find it. I have to press hard, okay? Sorry. So I begin in the right lower quadrant, find the iliacs, which are right there. So iliacs and transverse. Take that picture. Oftentimes you'll see the appendix draped over the iliac artery right there. This is not one of those times. There you can see the bowel. That looks like small bowel. If it was large bowel, it would have haustra, or those little pouches. That's most likely distal jejunum or ileum. Alright, take another picture there. You can see some gas. So if I don't find it there, I'll move up and lateral, and it's actually right there. So here you got your psoas muscle, and that's the appendix. So if I find the appendix in a longitudinal plane, even though I'm transverse on the body, I'll go transverse on it. Right there. Take a picture. Compress. It's already compressed, so it doesn't have to. You can't compress it anymore. So that's going to be about 3 millimeters. So take that. Good. Beautiful. Put color. Good. Take that. And then take some proximal and distal images of the appendix. Right there. Proximal right there. You can see it kind of coming off the cecum there. Alright, so take that. And then sagittal. So let's go right there. Take that. You can take another color image if you want. Does that hurt? Right there. Try to find the tip. Looks like it's about right there. Take that. My studies usually consist of about 20-25 images, maybe a little more if there's pathology. I do right upper quadrant images of the gallbladder and kidney, sagittal and transverse. Then the right lower quadrant images. If I don't find the appendix, I'll just take several right lower quadrant images in sagittal, transverse. Look for any lymph nodes, look for any bowel wall thickening, free fluid. And then I end the exam by looking at the bladder. So this one's draped right along the psoas muscle. All right. Very normal. Congratulations, you don't have appendicitis, bro. Take that. So if I don't find it there, I'll move more laterally and I'll go right there where the obliques are right there. So those are the obliques, and oftentimes you'll find it tucked in this area here, whether it's positive or negative. And you can go up and down up to where the kidney is. I find it there often. If I don't find it there, I'll move more medial to midline and try to see if I can find it draped over the vertebrae, if I can see the vertebrae in the patient. And once again, my number one tip for this is press. You have to press real hard. On him, he's slender, so you don't have to press as hard. But on some people, you do. Now, when they do have appendicitis, obviously they're not going to let you press that much. But if they don't and they can tolerate the pain, pressing hard will help you find it. So that's regular bowel there. You can see it's thin-walled. And then let's see if we can see. Oftentimes the ascending colon is full of air. You can't really make out the ascending colon. But if there's bowel wall thickening, you can see it. And if there's not that much air, you can see it. But that's the haustra right there that I was talking about. So I know this is ascending colon. Right there, you see there's like a little pouch there. Another little pouch there. Another little pouch there. So you have the haustra of the colon. And you'll see that in the ascending, transverse, and descending colon. And in the small bowel, you won't see that. Small bowel actually can mimic the appendix. Sometimes you'll see the terminal ileum and it'll look like the appendix. We've had cases of terminal ileitis that mimicked appendicitis, so keep that in mind. And that's pretty much it. See if we can find it again. Sometimes you can find it once and then you go to look for it again, you can't see it because bowel air has moved into the way. But there it is. All right. So I'm holding this transducer a little different than I hold the other one, because the other ones have cables, and this one, I don't have the same dexterity I have with them. So that's the appendix right there. Beautiful. Boop, and that's where it ends. All right, well, thank you for joining. Take care. Bye.